Metformin is a widely prescribed medication for managing type 2 diabetes, celebrated for its efficacy in controlling blood sugar levels and its favorable safety profile compared to many other medications. Despite its popularity and the relief it brings to many, there are some important considerations to bear in mind when using metformin. The way you take this medication can significantly impact its effectiveness and your overall health. Understanding these nuances can help you avoid potential pitfalls. But before we continue, if you appreciate all the information and the research that goes into making a video like this, it does help out tremendously if you hit the like button and hit subscribe. Thank you, and let's begin. One of the key factors to consider is timing. Metformin is typically taken with meals to reduce gastrointestinal side effects. Taking it on an empty stomach can increase the risk of nausea, stomach pain, and diarrhea, which are common side effects. These symptoms, though often mild, can be distressing and discourage continued use. Studies have shown that splitting the dose between breakfast and dinner can help maintain a more consistent blood sugar level and minimize side effects. Hydration plays a crucial role when taking metformin. Dehydration can increase the risk of lactic acidosis, a rare but serious side effect of metformin. Lactic acidosis occurs when lactate builds up in the bloodstream, leading to a drop in pH levels, which can be life-threatening. Drinking plenty of water throughout the day helps to prevent dehydration and supports kidney function, which is essential for safely taking metformin. It's important to be mindful of your kidney health. Metformin is processed by the kidneys, and if they are not functioning properly, the drug can accumulate in your body, leading to potential toxicity. Regular kidney function tests are recommended for those on metformin, particularly if you have pre-existing kidney issues or are at risk of developing them. Monitoring kidney function helps ensure that metformin remains a safe and effective treatment option for you. Alcohol consumption is another factor to consider. Excessive alcohol intake can increase the risk of lactic acidosis and affect blood sugar control. It's generally advised to limit alcohol consumption to moderate levels if you are taking metformin. For men, this typically means up to 2 drinks per day, and for women, up to 1 drink per day. Keeping within these limits can help maintain the balance needed for effective diabetes management. Interactions with other medications should not be overlooked. Metformin can interact with a variety of drugs, which may either enhance or diminish its effects. For example, certain diuretics and corticosteroids can increase blood sugar levels, potentially counteracting the benefits of metformin. On the other hand, medications such as cimetidine, used for stomach issues, can increase metformin levels in the blood, raising the risk of side effects. Always inform your healthcare provider about any other medications or supplements you are taking to avoid harmful interactions. Dietary habits are another crucial aspect. While metformin helps control blood sugar, it is most effective when combined with a balanced diet. High-fiber foods can aid in managing blood sugar levels, but they should be introduced gradually to avoid gastrointestinal discomfort. On the contrary, high-fat and sugary foods can impair blood sugar control and should be limited. Eating regular, balanced meals helps stabilize blood sugar levels and enhances the effectiveness of metformin. Exercise is an excellent companion to metformin therapy. Regular physical activity helps improve insulin sensitivity and can lower blood sugar levels. It also promotes overall cardiovascular health, which is particularly important for those with diabetes. However, it's essential to monitor blood sugar levels to avoid hypoglycemia, especially if you are on other diabetes medications alongside metformin. Balancing exercise with appropriate dietary intake and medication timing is key to optimizing your diabetes management plan. Stress management cannot be ignored. Chronic stress can negatively impact blood sugar levels and overall health. Stress hormones like cortisol can increase blood sugar levels, counteracting the effects of metformin. Incorporating stress-reducing activities such as yoga, meditation, or even regular leisure activities can help maintain better blood sugar control. It's crucial to avoid self-adjusting your dose without consulting your healthcare provider. If you experience side effects or feel that the medication isn't working as expected, it's essential to discuss these concerns with your doctor. They can adjust the dosage or suggest alternative treatments if necessary. Taking more than the prescribed amount can increase the risk of severe side effects, including lactic acidosis. Finally, understanding and adhering to the prescribed regimen is vital. Metformin works best when taken consistently and as directed. Skipping doses or taking them irregularly can lead to poor blood sugar control and increase the risk of complications. Using reminders or setting a routine can help ensure that you take your medication correctly and consistently. One aspect of metformin use that deserves particular attention is the potential impact of vitamin B12 deficiency. Long-term use of metformin has been associated with reduced levels of vitamin B12, an essential nutrient for nerve function and the production of red blood cells. Studies indicate that between 10% and 30% of individuals on long-term metformin therapy may experience significant drops in vitamin B12 levels. This deficiency can lead to symptoms such as fatigue, weakness, numbness, and tingling in the hands and feet, which can sometimes be mistaken for diabetic neuropathy. To address this, it is advisable to have your vitamin B12 levels checked regularly if you are taking metformin for an extended period. If a deficiency is detected, your healthcare provider may recommend dietary adjustments, oral supplements, or even B12 injections to correct the imbalance. Ensuring adequate vitamin B12 intake can help prevent these symptoms and maintain overall health. Additionally, it is crucial to understand how certain foods and beverages might affect the absorption and efficacy of metformin. For instance, consuming large amounts of grapefruit or grapefruit juice can interfere with the enzymes that metabolize metformin, potentially leading to higher levels of the drug in your bloodstream and increasing the risk of side effects. Similarly, high-fiber diets, while generally beneficial for managing diabetes, can sometimes slow the absorption of metformin, reducing its effectiveness. Therefore, it's important to balance fiber intake and monitor how your body responds to different foods when taking metformin. Another point of consideration is the interaction between metformin and other medical conditions. For individuals with conditions such as liver disease or severe heart failure, metformin use requires careful monitoring and sometimes adjustment. Liver disease can affect how your body processes medications, including metformin, while severe heart failure can complicate the body's ability to manage fluids and electrolytes, further impacting metformin's safety and efficacy. If you have these or other chronic conditions, it's essential to have a thorough discussion with your healthcare provider to determine the best way to integrate metformin into your treatment regimen. Lastly, the form of metformin you take can also make a difference. Metformin is available in immediate release and extended release formulations. The extended release form can be beneficial for individuals who experience gastrointestinal side effects from the immediate release version, as it is designed to be gentler on the stomach. Discussing these options with your healthcare provider can help you find the most suitable form of metformin for your needs, thereby enhancing your overall treatment experience. In conclusion, while metformin is a highly effective and commonly used medication for managing type 2 diabetes, its effectiveness and safety are significantly influenced by how it is taken. Timing, hydration, kidney health, alcohol consumption, interactions with other medications, diet, exercise, stress management, dosage adherence, and consistent use all play crucial roles in maximizing the benefits of metformin while minimizing potential risks. By paying attention to these factors, you can better manage your diabetes and maintain a higher quality of life. Remember, the best outcomes are achieved through a combination of medication, lifestyle modifications, and regular consultations with your healthcare provider. Your commitment to understanding and optimizing the way you take metformin can make a substantial difference in your diabetes management journey.